So let us look at the burden of communicable diseases, especially in the context of developing countries. We want to understand to what extent are we having communicable diseases affecting the well-being of people living in developing nations. Health is an important aspect of our well-being. You can't talk about well-being without mentioning about health. So that means that if one's health is actually affected, then one's well-being or quality of life is actually going to be impacted. We want a society that is composed of individuals that are living a happy lifestyle where they can actually achieve their potential. Okay, that's what we basically want to have in our communities, in the society where we are staying. Okay, and for us to be able to achieve that level of optimal well-being or optimal health, we need to basically spend resources on health. That means that the revenue that the government collects, a large proportion of that revenue should be directed towards improving health. So that's why we are saying that proper health expenditure or higher health expenditure is linked to a longer life expectancy. That means that people are likely to live longer if the government appropriately uses the money to improve health. And then the other thing is that if investments in health are made, it is possible to reduce infant mortality. And therefore, if you prevent infants from dying, then it is likely that we are going to live longer. So low infant mortality results into higher life expectancy. But if you have higher infant mortality, then you're likely to have lower life expectancy. Okay, so therefore, apart from spending resources into the health system, spending resources to improve the health system, it's also very important to improve people's income levels. Okay, because if people are earning decent amounts of income, then it is likely that we are also going to have a longer life expectancy. However, when you have low government expenditure in health, then you're going to have diseases that could otherwise be prevented occurring at high proportions. So you're going to have deaths that are resulting from TB, AIDS, and this will greatly reduce the life expectancy. That means that addressing these diseases actually is very important. Okay, and then the other element that also is worth looking at is what we call the Human Development Index. The Human Development Index is a statistical matrix that is used to compare. We look at the level, we actually look at life expectancy, then we look at the number of years that someone has spent in school, And then also we look at issues to do with per capita indicators. So it is basically a composite indicator that looks at all those things. So we can categorize countries depending on their human development index. So countries that have low human development index are actually poor countries, and therefore they actually have poor health outcomes, and as exhibited by low life expectancy. So that's the problem there. The other thing that we can really do to make sure that we can improve people's well-being is ensuring that we have um, a good environment, an environment that has sanitary facilities, uh, that ensures that you don't have communicable disease outbreaks happening. People live in decent housing, and therefore you don't have them overcrowded and increasing the risk of TB. Okay, so basically the whole point is that people should be provided with decent living conditions, decent housing, uh, decent sanitary facilities, a clean environment, access to clean water, things like that. When you have improvement in sanitation, then you're also going to have a reduction in infant mortality and disease prevalence. You don't want to spend a lot of money treating diseases. So what justification do you have for government to spend um, a sizable proportion of its budget in health? The justifications lie from the fact that if you improve health, you're actually going to improve the economic outlook of the country. That means that individuals who are healthy are likely to work and be more productive compared to those that are sick. Okay, and when people actually work, it means that they can be able to pay taxes and support the government. So that means they actually contribute to development. And also, when you reduce infant mortality, it means you're going to stabilize population growth. So that is actually very good justification for spending resources in the health sector. Uh, from an economic point of view, if if someone if you have individuals exceeding their life the national life expectancy, that means for every extra year that they actually live, they contribute to about 4% increase in their GDP per capita. So that means that they actually contribute positively in terms of the economy. And it's the same thing that can be advanced by saying that if you reduce adult mortality, then it means that you're also going to contribute to economic growth. Okay, so uh, for the past years, there have been uh, significant increase in life expectancy, and that correlates with the increase in economic growth, global economic growth. So, given that spending in the health sector improves people's well-being and health outcomes, uh, it would be logical for countries to actually spend more in health. Unfortunately, that is not the case. Um, as you can see here, Sub-Saharan Africa, uh, 2.8% um, of the GDP is spent on health. South Asia, 1.18%. And then you see that high income countries are instead spending more in health, that is 7.36. And that therefore means that those that are having poor health outcomes are actually spending less. Here, those that are having uh, better health outcomes are actually spending more. Okay, it's like uh, one who is supposed to improve is actually not improving. One who is supposed to be happy is actually working harder. So that's the situation that we have in there. Okay, and there is a significant linkage between communicable diseases and the poverty. Now, some of these communicable diseases are actually termed as diseases of the poor because um, if one has decent lives in a decent life, that is it is unlikely that they can suffer from some of these diseases that overburden health systems in developing countries. Okay, we shall see what these diseases are and by what proportion do they affect people living. Okay, but generally, communicable diseases um, pose a significant burden to health systems in countries that are developing, Africa, Asia, and America. And largely, it is being driven by uh, these diseases are driven by poor living conditions associated with poverty. So TB, malaria, HIV, and diarrheal conditions are some of these communicable diseases. Here we are terming them as contagious diseases. You can see that the numbers of death attributable to these conditions are in millions. TB, you can see it is 1.6. That was by 2001, and then by 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 2030, the, the deaths are projected to be 500,000. And then malaria, you can still see that still, though there is a continuous improvement for all these diseases, but you can still see that the deaths are still significantly high, especially given the advancement that we have in prevention, technology, and medical care. Okay, so you can see that HIV, stroke AIDS, tuberculosis, malaria, these ones highly affect um, individuals staying in Africa. And still, even within Africa, you have categorization of countries uh, where we have middle income countries, lower middle income countries, and things like that. But generally, countries that are having low incomes are having a greater burden of the communicable diseases. And of course, these are usually linked. Low income, weak health systems, and also low human development index that we talked about earlier on. Okay, usually for the countries that are having a great burden of tuberculosis, HIV, and malaria, you will have TB and HIV occurring at the same time in an individual, and that is the case of what we call co-infection. So co-infection rates for TB and HIV are actually very, very high. And usually, the top 6 countries that are affected by malaria are also having a high burden of TB and HIV. Where you have Nigeria, Ethiopia, Kenya, Uganda, and Mozambique. Okay, so we can now turn our focus to what happens in infant and child health. Um, Still in this category, we still have problems, uh, poor health outcomes, especially here. We are talking about death. The deaths are actually very high. for infants and children. You still have stillbirth, neonatal conditions, many of them, and now we have many of them under this category, whether neonatal pneumonia, whether it is sepsis, neonatal sepsis, or other conditions, they actually still very many, resulting into significant infant mortalities and under 5 mortality. Yet, it is actually possible to improve infant and child health through having safe delivery practices. This is to say that if you have a skilled birth attendant attending to these deliveries, then it is likely that you're going to prevent sepsis and all these other neonatal conditions that contribute significantly to neonatal mortality and infant mortality. Exclusive breastfeeding, prevention of malaria and other infections, and also ensuring that you have health services that are efficient and provide quality care. Okay. Just like what we explained earlier on, the environment plays an important role in the health of infants. Okay, that means if you have poor sanitation, then you're going to have problems with infant mortality. So that means that wash services actually contribute to improving maternal, maternal and even infant health. Okay, but in this case, we're talking about reducing infant mortality. Access to clean water and sanitation is very important. We have countries that are actually doing poorly in terms of under 5 mortality. You have Sierra Leone, Chad, Mozambique, and South Sudan is not also far away from these countries. Okay, so we have looked at the issues that happen in developing countries in terms of the communicable diseases, then in terms of what affects infants. Now, we are turning our attention to what really contributes to greater life expectancy and what are the trends. So, historically, during before the Middle Ages, life expectancy was around 40. But with industrial revolution and advancements in medical care, life expectancy actually increased. And countries that have high life expectancy include Europe, countries in Europe, and then also Japan with almost about 80 years of life expectancy. And then Latin America, South Asia, and Sub-Saharan Africa, you have not a very great improvement in life expectancy. Okay, then with Sub-Saharan Africa, with AIDS coming in the early 90s, you have there was a decline in life expectancy, but over time, life expectancy improved because, of course, of the drugs that can suppress virus. Okay. What we have seen is what happens with developing countries and the other countries that are still developing. But within these countries, we also need to be aware that you can also have variations within in terms of health outcomes. Okay, what we term as internal disparities within countries. So if we say that a country X is highly affected by HIV, stroke AIDS, you may want to look at who are those people within that country that are highly affected by this condition. And then you ask yourself, why are they affected by this condition? And so you will get the reasons for these disparities. So often, areas that are urban have better health outcomes compared to rural areas. So that means that if you're looking at a particular country, you need to look into the variations at that level. And then we have communities that we term as marginalized. This can be marginalized because of historical or political issues. Okay, it is possible to improve health in developing countries, and the success stories have been seen with China, Sri Lanka, Costa Rica, and many other countries. The key drivers are that if you improve literacy uh, and then reduce infant mortality, and have very strong primary healthcare systems, then you are likely to improve uh, health system performance in developing countries. Okay, still, this is basically still to emphasize that if you don't address issues to do with communicable diseases, they can actually result into a greater burden, and that burden can actually affect economies of countries, continents, and even the globe at large. For example, the COVID-19 pandemic caused this significant disruption in economies. Okay, people lost jobs, health systems actually broke down. So it is very, very, very important to have um, systems in place, surveillance disease, communicable disease surveillance systems, uh, preparedness for outbreaks, investment in human resource, investment in research, and all these things are very important to mitigate such grave consequences of pandemics. Okay, um, over time there has been significant improvement in terms of health. Of course, knowledge in terms of understanding that these communicable diseases are actually caused by germs, and that is the germ theory. Just need to remember that previously people did not actually understand what cause some of these diseases like cholera, typhoid, and things like that. People didn't understand that these are communicable diseases caused by microbes. But with the germ theory that came into force, and there was significant reduction in mortality and morbidity associated with communicable diseases. So that is one of the breakthroughs in contributing to reduction in mortality. And then, of course, subsequently,